Hello everyone, and thank you for taking the time to view my presentation. Today I'm discussing an important issue, support systems and institutional gaps for students with traumatic brain injury in higher education. This slide provides an overview of my presentation. I'll begin by defining the issue, explain why it is an important concern, and discuss the causes and antecedents that contribute to the issue. The majority of the presentation will focus on the literature review, including what research says about institutional disability services, family support services, systems rehabilitation-based supports, and broader equity concerns. After reviewing the literature, I'll present several realistic and research-based recommendations for improving support for students with TBI, and I'll conclude with a summary of the major findings and implications for higher ed institutions. The issue selected is one of the leading as the support systems and institutional gaps experienced by students with traumatic brain injury in higher education. Traumatic brain injury is one of the leading causes of long-term disabilities worldwide, and it has important implications for post-secondary education. Students with TBI may experience ongoing difficulties with memory, attention, organization, problem-solving, emotional regulation, processing speed, communication, and cognitive fatigue. These challenges can directly interfere with classroom participation, assignment completion, academic persistence, and overall student success. A major challenge is that a TBI is often considered invisible. Students may appear physically fine while still experiencing these serious internal cognitive and emotional impairments. Because of that, their needs may be overlooked or misunderstood. And at the same time, higher ed disability services often focusing on providing accommodation to ensure legal access, which are important, but the literature suggests that they often do not fully address the functional and executive functioning needs of students with TBI. As a result, student success may depend heavily on family support, rehabilitation providers, and other outside sources rather than on institutional systems alone. This issue matters because it intersects with several central concerns in higher education, including equity, inclusion, disability, justice, retention, and student success. Federal disability legislation, such as American with Disabilities Act and Section 504, has expanded access to higher education with students with disability. However, access alone does not guarantee equitable outcomes. This issue also raises important questions about institutional responsibility. If a student's disability affects memory, organization, communication, self-advocacy, then expecting that a student to independently navigate a complicated accommodation system may unintentionally create more barriers. In that sense, this topic is really about the difference between simply allowing students to enter higher ed and actually creating conditions that allow them to succeed while they're there. There are several causes and antecedents that contribute to the issue. First, as mentioned, it's invisible and highly variable. Second, support systems are accommodation-based and compliance-focused. They're structured to meet legal requirements, but they often do not address the broader issues such as cognitive fatigue, self-management, emotional adjustment, and executive functioning. Third, disability services depend heavily on student disclosure and self-advocacy. And for students with TBI, whose disability may directly affect organization, communication, this process can be especially difficult. Finally, there is often poor coordination between higher ed, healthcare, and rehabilitation systems. Students may receive clinical recommendations from rehabilitation providers, but those recommendations do not always translate into institutional support. Traumatic brain injury is generally defined as a disruption in normal brain functioning caused by an external force. In higher ed, it's especially significant because it often affects those very skills that students often need the most. Another important point is that TBI does not look the same for every student. Some recover quickly while others experience long-term or permanent challenges. The number of students with disability in higher ed has increased substantially over time. However, they are under-identified because not all students disclose their disability, seek accommodations, or receive diagnosis before entering college. The educational impact of TBI is significant because executive functioning deficits can interfere with planning, organization, prioritization, and time management. Students may also face social and emotional challenges, such as anxiety, frustration, isolation, and changes in self-confidence. Taken together, these barriers can negatively affect persistence that are associated with lower retention and graduation rates. The policy context for this issue is primarily grounded in the ADA Act and Section 504 of Rehabilitation Act. These laws prohibit discrimination and ensure equal access. In practice, disability services offices are usually responsible for implementing accommodations such as extended testing time, note-taking assistance, flexible attendance, or reduced distraction on testing environments. These policies are critical because they protect students' rights and expand access to higher education. However, the literature suggests that the policy framework is still largely centered on access, not on persistence, graduation, or holistic student success. That means institutions may technically comply with the law while still leaving major cognitive, emotional, and executive functioning needs unaddressed. The first major area of the literature is institutional support. Disability services offices are the primary support structure for students with disabilities in higher ed. These systems have important strengths. They create centralized point of contact for students, help ensure legal compliance, and reduce some immediate academic barriers. However, the literature suggests that these systems often focus on accommodation and access rather than on long-term persistence and student success. For students with TBI, that can be a major limitation because the most significant barriers are not always solved through accommodations alone. Executive functioning deficits, fluctuating symptoms, fatigue, and psychosocial challenges often require more comprehensive and ongoing support. The literature identifies several institutional barriers that contribute to affect students with TBI, even with disability services. One major barrier is limited faculty and staff knowledge of traumatic brain injury. Many educators receive little training on the cognitive and behavioral effect of brain injury, which can lead to misunderstandings about students' needs and abilities. The invisible nature of TBI adds to the problem. Another barrier is inconsistency in how accommodations are implemented across courses, departments, and institutions. Advising, registration, and academic planning systems often require high levels of organization, self-monitoring, and follow-through, which are precisely the areas where students with TBI struggle most. A central argument in the literature is that there is misalignment between institutional support models and the actual needs. Traditional accommodations often address surface level barriers, and those supports are helpful, but they don't adapt to the fluctuating cognitive symptoms. Another challenge is that accommodation plans are often static. A student may receive a set of accommodations at the start of the semester, but TBI symptoms can change. Finally, because the institutions expect students to advocate for themselves, request changes, coordinate services, students with TBI may face additional barriers simply trying to use the support systems that was meant to help them. A second major theme in the literature is family support systems. Families often serve as a critical support structure. They may help with scheduling, organization, medical reminders, etc. This kind of support can be tremendously beneficial. It can also improve stability, reduce stress, and help students persist through academic and personal challenges. However, the literature shows that dependence on family support reveals a deeper institutional problem. If students needs unpaid if students need unpaid caregivers to help them navigate higher ed, that suggests that institution is not fully meeting their needs. This creates a serious equity concern because not all students have access to strong family support. Students may benefit from the rehabilitation-based supports. Key supports are speech language pathology, occupational therapy, and vocational rehabilitation services. And these can help with memory strategies and all the various deficits that TBIs cause. However, one of the major challenges in the literature is that the rehabilitation systems operate separately. Communication between disability services offices and rehabilitation providers is often limited or informal. As a result, the clinical recommendations may never fully be integrated into the academic support plans, and this fragmentation places the burden on the students and families to connect the dots between the systems, which can be especially difficult for students already experiencing challenges. One of the most important findings is about equity. Students with TBI may be granted access to higher ed through disability legislation, but access alone does not guarantee equitable outcomes. In other words, students with more social capital may be better positioned to succeed, while students without those external resources may struggle even more. The first major solution is TBI-informed disability services. So traditional disability services are often reactive and centered on accommodations, but a TBI-informed model would be more proactive, individualized, and functionally oriented. One recommendation is the creation of TBI case management with disability services offices. Rather than simply approving accommodations, a case manager could help monitor changing needs, coordinate support, and reduce the burden on the student to manage everything alone. Another important recommendation is executive functioning coaching. Since executive functioning deficits are one of the most significant barriers for students with TBIs, colleges could offer structured support for time management, planning organization, prioritization, and task initiation. The literature also supports individualized academic planning, including flexible course loads, structured check-ins, and ongoing progress monitoring. These approaches acknowledge that TBI symptoms can fluctuate and that support needs may change over time. A second major recommendation is the use of universal design for learning. It's a proactive instructional framework that reduces barriers by designing courses more accessible from the beginning. Examples of UDL practices include scaffolding assignments, multimodal delivery of course materials, predictable routines, clear course organization, and multiple ways for students to demonstrate learning. UDL shifts the responsibility for accessibility away from the individual student and toward an institutional course design. A third recommendation is to build stronger partnerships between higher ed institutions and rehabilitation providers. The literature suggests that colleges and universities should not operate in isolation when supporting students with TBI. Formal partnerships with speech-language pathologists, occupational therapists, vocational rehabilitation counselors could help bridge the gap between clinical support and academic support. This kind of collaboration would reduce fragmentation. Faculty and staff training is essential. The literature consistently shows that limited awareness of TBI contributes to misunderstanding, stigma, and inconsistent accommodation implementation. Faculty and staff need a stronger understanding of how TBI can affect memory, attention, organization, communication, emotional regulation, and stamina. Training should also address the invisible nature of TBI. When educators understand this, they are more likely to respond with flexibility, empathy, and appropriate support rather than assuming poor effort or lack of motivation. In addition, training can improve consistency in how accommodations are implemented and encourage more disability-informed, trauma-informed teaching practices across the institution. Finally, literature supports policy-level recommendations. One is for institutions to develop TBI-specific guidelines rather than relying solely on the broad disability policies. Another recommendation is to create more formal communication and collaboration protocols among disability services, faculty, academic advisors, rehabilitation providers, and when appropriate, families. This would reduce fragmentation. Most importantly, institutions should move beyond measuring compliance alone. It's not enough to ask whether a student receives accommodations. Institutions should also examine whether students with disabilities are persisting, graduating, and experiencing equitable outcomes. In conclusion, the literature demonstrates that students with TBI face complex and invisible barriers in higher ed that are not fully addressed by traditional accommodation-based systems. Although disability services remain essential for ensuring access, they often do not fully address executive functioning deficits, cognitive fatigue, fluctuating symptoms, emotional adjustment, and long-term persistence. As a result, families and rehabilitation providers frequently step in to fill the gaps left by institutional systems. This raises an equity concerns because access to family support, financial resources, and rehabilitation services is unevenly distributed. If higher ed is truly committed to equity and student success, institutions must move beyond minimal compliance and toward integrative, proactive, TBI-informed systems that better align with realities of traumatic brain injury. My final takeaway is access is not enough. Students with traumatic brain injury need support systems that are designed not only to provide accommodations, but to support persistence, inclusion, and long-term success. When institutions rely too heavily on students to self-advocate and independently navigate complex educational systems, they risk reinforcing inequity rather than reducing it. A more effective approach is one that recognizes the realities of TBI and responds with coordinated, individualized, and proactive support. Thank you so much for listening.